experience then, mostly in a professional sense, but feel free to delve into personal as well. What's the deal? What's your experience with different types of lubes? Sue, can I start with you on that one, if that's all right? One of our newcomers.
Yeah, of course you can. Well, I suppose I can relate to this in three different ways. I can think about from a nursing experience, I can think about it from a sex therapy experience, and I can think about it from my own personal experience. So I'll take them in turn.
Yeah.
From a nursing experience, most of my oncology background, I guess, is working with patients who have sexual side effects from their disease itself, and also sexual side effects from the chemotherapy, radiotherapy, or hormone therapy, all of which can impact on sexual lubrication and sometimes on function. And I think from a nursing point of view, I would always include discussion about the client's normal sexual pleasures and how that might be impacted and what we can do about it very early on, before they've had any treatment. We start making an assessment of that so that we know what their baseline is, if you like, and also to talk about what their goals might be in the future. And this is way before they've got involved in complex treatments. And I think that's super important because it does give you an idea about what kind of lubrication might be required. I don't get into the different types at that point. I'm just leaving it for them to think about. Also, we need to know what they've used in the past and was that useful to them.
Right.
From a sex therapy point of view, I think the principal thing has always been not to leap into kind of a recommendation about a particular lube, but to make sure that this couple, assuming there's a couple in the room, talk about the need for lube. What lube? Who's going to buy it? Who's going to apply it? Where are they going to apply it? To themselves or to their partner? When? Before they have sex? After, during? How's that going to happen?
Okay.
And the reason I think that's important is I've had a number of conversations with people where they've been particularly unhappy with the way lubricant has arrived in the bedroom.
Oh.
So potentially their partner has just turned up with a supersized bottle of silicone, and well, what's that actually telling your partner? Oh my God, he wants anal sex. It could be a real moment of, oh, have I not been giving him what he wanted? Am I really dry down there? We've not had that conversation.
Right.
So I think that's really, really important that we have that discussion in the room about how it's going to go. Somebody once said to me, oh, I hate it when we're at that point and he's about to penetrate and he spits on his hand and slaps it on my bits. It just completely puts me right off.
Isn't it romantic? Yeah, that's fair, isn't it?
But they've been having sex together for 12 years and they'd never had that conversation. So I think it's a really important thing.
So don't just show up, people, with a tube of lube in your as
well,
a surprise.
Some people that's a turn on.
Right.
But it's a risk.
I agree. I think Sue brings up a great point. It's key to talk to your partner. Whatever you do, it's not you alone, and it's about mutually enjoying it. And I think it's absolutely essential to know what your partner likes and what your partner knows what you like. Unless you don't tell your partner, there's no way your partner's going to know. So no, that's a great point, Sue.
Thank you. And I think it accounts as well, even if it's a one-night stand. It should be out there. You're going to do something incredibly intimate with somebody. You can at least have the conversation about doing it safely and pleasurably.
Absolutely.
And then from a personal point of view, and I suppose this is a bit of a handy hint to the world out there, I'm aware that I leave my lube in the drawer for months, if not years. This is a really bad thing to do. Do not do this, people. It's, you wouldn't find some eye drops that have been on the shelf out of date and stick them in your eye, would you? No, you would not. So check your out of dates, renew your lube regularly, please. Don't use it when it's scabby.
What happens if it's too old to lube? Does it just become all dried out and pasty or something? What happens?
Yeah, well, it degenerates for sure, but also it's a wet substance that's, if it's been already opened, it's vulnerable to bacteria. So you're going to potentially infect yourself or certainly introduce something unpleasant. So yeah.
Wow.
I'm pretty sure a lot of people don't know that. So yeah, that's again something people should look out for, because yeah, as Sue said, lubes can just lie in the cupboard forever.
Yeah.
I didn't know about that. So yeah, I'll be getting rid of any old lube.
Go and check your out-of-date dates.
Check my cupboards. Thank you very much, Sue. Anybody else? Let's talk about your other people's experiences with lubes.
So as you were saying that there about, that in regards to the care of lube and not keeping it and the risk of infection, I guess when we're looking at lube as well, there could be a possibility of reactions, and it's really important to check what the ingredients are in regards to what's in lube for certain people, because they could have allergies, allergic reactions to any ingredients in the lube.
Yeah.
So would you recommend a patch test, Lorraine?
I'd say that would be a really good idea. A bit like when you're testing anything with certain chemicals or ingredients in it. It's just to test. Yeah, I'd say that would be a really good idea.
I know a lot with silicone lubes. They're generally hypoallergenic lubes, but equally, there's no guarantee that you're not going to have a reaction. So I agree completely. I suppose it's a bit more difficult if it's a one-night stand. You can't say, well, I'll just put a little bit on here and we'll give it a couple of hours and see what happens. But if it's a regular partner and it's a new lube, why not?
Yeah.
Where's the best place to test that out? Is there any particular, like a sensitive part of your skin you should try it out on patch-wise, or, go right on the bits there, or what should we do?
I don't know. What would you say, Lorraine?
I wouldn't say go straight on the bit.
No, you don't want different unpleasant sensations there, do you, Rob? So.
No.
Maybe the inner thigh. That's always a sensitive part. You put it right in there, see if that works, or if you get a big red, something grows. It's bad. Okay.
Yeah,
can I just?
Yes, Angela.
We've been using silicone-based lubricants. We actually supply them in the clinic.
Yeah.
We've had the same silicone-based lubricant for about 20 years, and we originally got it because we could buy it in sachets, and we tend to give it out regularly.
Okay.
And I would say that probably about 85% of the women that I've seen that I've given lubricant to, this particular lubricant, we've probably have no issues with irritation or infection. But I do think there is a small minority where it can cause irritation. But in general, I've found the silicone-based lubricant that we use very successful.
Me too. It's absolutely my go-to lube. I don't bother with the others, to be truthful.
Yeah.
And it's so slippy. I mean, it does stay really slippy on your skin, because often a lot of the water-based ones, you need a plant sprayer with water in to keep it going for a bit longer, whereas the silicone ones will just last and last. And I always remember something Sue used to say in some of our workshops, that be careful when you shower it off, because actually you might slip in the shower. So it really does stay on your skin.
Yeah, my recommendation for that is to make sure you wipe as much as you can off with a dry towel or a tissue before you get in the shower. Certainly people have been known to fall and fracture their hips after using lubricant. It's not something that's easy to explain in ICU, in A&E.
Well, you see why disclaimers are important everywhere. So there's a health hazard all the time.
Yeah.
And can I, I've got a funny story actually. My friend Julie, I've actually warned her, I'm going to mention her name. She was having a cervical cytology done with her GP. And they were talking generally, and she said, my friend's a sex therapist. And she said, not that mad Angela Gregory. Yeah. So she said, actually, yes, it is that mad Angela Gregory. And she went, well, I've been to one of her lectures, and her advice on using a silicone-based lubricant has revolutionized my life and also the lives of my patients.
Wow.
That's well good feedback, isn't it? Excellent.
That's awesome.